Uno, dos, tres.
I support a total of all three of our units, but I directly oversee operations for two Sprinter vans, just like the one you see behind us. So these are vans that have been upfitted for clinical services, and we provide things like immunizations and HIV and STI testing, screening in the community.
All right. It's good to see you.
For those of us working in public health, we're always vigilant. We're always watching and doing our best to to prevent and mitigate disease in our community. And it feels like you're fighting an uphill battle.
Guys tracking down kids was easier for handing out. Like,
our mobile units have really allowed us to get out into the community and reach more people. We're at the schools, we're at different community events, health fairs, weekends like in the summer and the fall where we're having all of these festivals. And you know, there's a lot of demand since we've had our mobile units for us to be present in the community, to provide education, to provide vaccines. So they have definitely been instrumental in us reaching the masses.
Wait about 15 minutes, and then Miss Allison, another one of the nurses,
El corazón, el hígado.
asthma, diabetes.
But at the end of the day, when you don't have the funding, you can't keep the people employed. So that is hard to see people, really great public health workers, and so you want to see the work that they're doing continue. But also it creates some uncertainty for the rest of us of, how can we keep this important work going?
The governmental public health system, the federal, the state, and the local arm, is the core system that keeps communities safe and healthy and well and thriving in lots of cases. And if any part of that starts to shift, we could see direct and immediate impacts to the health of people on the ground. In other cases, for example, in Texas, the small county would probably basically consist of vaccination, immunization services. So you have to shift the narrative a bit in order for it to resonate. Nobody wants to go swim in a community pool and come out of it with a rash or a disease from it. Nobody wants to walk out their door and take a fresh breath of air and start wheezing. These are the things that we do behind the scenes.
Oftentimes we get short-term money to deal with whatever the problem of the day is, and then when the problem of the day starts to go away, the money goes away with it.
Now I'm elected by the people of District 6. Thank you.
Sliding scales or the charity care. So that really...
That program was started by the health systems essentially, and so it's there.
To some of our nonprofit clinics, they provide us data and expertise.
If you pull a resource, then something's not happening, which is often the case. And I think this is why us and local public health, and I think even our state partners hear us with this, is that we really need to make sure we have strong infrastructure that's flexible to just address health.
¿Alergia a comida, medicinas o látex?
No, nada.
We have a lot of emerging health threats that we are, you know, and those that are unknown. I mean, you know, there's the question of what's to come. You know, COVID, 5 years ago, COVID wasn't a thing. So we didn't talk about it, but it went from not being a thing to the third leading cause of death in our community. As an example of how quickly health can be impacted in a community. And so we have to be prepared for the things that we know are coming, and we have a lot of those on the long list of infections that are currently we're not winning on. And then the things that are potentially to come that we have to be prepared for. And if we don't have the infrastructure, we can't build it in real time.